Good morning friends, I am Dr. Meghna Ved. I am a consultant homeopath and a backflower therapist practicing in Ahmedabad and running my clinic Daivik Homeo Care. And today I will be talking about piles or hemorrhoids, the causes of piles, its symptoms and its management. So let's begin. Okay, first of all, what are piles? Piles are swollen veins that are present in the rectum or in the anus. Now, piles or hemorrhoids basically is a lifestyle disorder. Okay, so it has happened due to some or other imbalance in your lifestyle. Most common cause is chronic constipation. Okay, if you are taking a long time while passing stool, sitting for a long time and straining a lot while passing stool, then you are likely to suffer from piles. Second is if you are taking less amount of fiber in your food, or if you are taking less amount of fluids or water, then you are likely to suffer from piles. Third is if you are overweight. Okay, it can lead to extra pressure on the rectum, further leading to piles. Other than that, if you are involved in jobs that require you sitting for long hours, like if your lifestyle is sedentary, movement is less, your exercise is less, then you can suffer from piles. Okay, other than that, piles sometimes can be hereditary. Okay, because sometimes chronic constipation also comes in hereditary, so there could be a hereditary predisposition to suffer from hemorrhoids. Okay, other than that, during pregnancy piles are common because of pressure of fetus on the rectum. Okay, and the most common cause is irregular food habits. If you are taking foods, or for example, if you are skipping breakfast, taking lunch at 2 to 3 o'clock, dinner even at later after 8 o'clock, then all these can disturb your digestive system and it could lead to piles. Okay, so irregular food habits, taking outside food, junk food, eating ready to cook meals like pastas or noodles, or foods that are rich in maida or white bread. Now all these reasons could lead to piles. Okay, other than that, certain addictions like alcoholism or tobacco or smoking can also lead to hemorrhoids. Fine. So these are the reasons a person can suffer from hemorrhoids. Okay, now what are the types of hemorrhoids? There are two types basically. One is internal, where the piles are inside. Okay, so the veins do not come out. These are usually inside, and you can have pain while passing stool. Pain remains for around 10-15 minutes and goes away. And other is external piles, where the swollen veins come out while passing stool, and in the first stage they go back after the stool has been passed, and in the later stage the piles can be prolapsed, where the swollen veins remain outside whole day, leading to discomfort and pain. Okay, so these are the two types of hemorrhoids, internal and external hemorrhoids. And other than that, the symptoms of hemorrhoids could be, first is there could be pain. Okay, there could be stitching type of pain, as if some sticks are piercing in the rectum. Pain can be there can be burning, there can be irritation, sometimes mucus can pass in the stool, and sometimes there could be blood. Okay, bleeding piles are also there. So these are the symptoms of piles. Okay, now let's talk about management. Management includes all the lifestyle changes which you need to do. First and foremost is preventing constipation. Other than that, do not keep a habit of taking laxatives like Kayam churn or a milk of magnesia, any laxatives. If you are a habit of taking it daily, then it can lead to prolapse of piles. Okay, so avoid being dependent on any kind of laxatives. Include more amount of fibers in your diet. Include vegetables that are rich in fiber like cauliflower, cabbage, or fruits like apples, papayas, banana, oranges, grapes. These are rich in fiber and also rich in fluids. Fine. Other than that, include anjeer or khajur. These two you can soak it at night and have it in the morning. Soaked khajur and soaked anjeer work really well. They improve the fiber amount. Sweet potatoes and papaya are very good source of fiber. Include oats in your diet, or whole wheat bread or multigrain atta should be included. Fine. Include more amount of soups, buttermilk, curd, dahi, right? Include all these fluids in your diet, and this can gradually relieve your constipation and ultimately treat the piles symptom also. Okay, so these are the food changes. For temporary relief, you can have sitz bath, where there is a specialized amount of tub. You have to fill it with warm water, and homeopathy remedies calendula is available. Calendula drops you can add in this warm bath and sit for some time. It can give temporary relief, although it's not going to cure piles, but it can give temporary relief in pain. Okay, so these are the changes which you can take in order to deal with piles. Now let's talk about homeopathic line of treatment. Homeopathy works wonderfully in permanently curing piles. Let's talk about some of the remedies. First and foremost remedy which I am using is Aesculus hypocyanetum. It is a very nice remedy if you are suffering from painful piles. If you are having pain as if sticks are piercing in the rectum, the pain remains even after passing stool, and mostly these piles are non-bleeding. Okay, so Aesculus hypocyanetum is the main remedy which I am using. Second remedy which I am using is Nux vomica. It is a very good remedy if piles are due to chronic constipation or due to sedentary lifestyle or because of addictions like tobacco or alcoholism. Then Nux vomica works wonderfully. Third remedy which I am using is Aloe-socotrina. It is a very good remedy for protruding piles. Piles are big, prolapsed, they do not go back. There could be lot of itching or mucus present. Then Aloe-socotrina. It's a very nice remedy for piles. Other than that, I am using sulfur. It is a very good remedy if the piles are with bleeding, burning or itching and stinging pains, and person is suffering from chronic digestive disorders, chronic constipation or chronic diarrhea. Then sulfur can be given as an intercurrent remedy also. So sulfur is a very beautiful remedy for curing piles. Other than that, the remedy which I am using is Calcarea fluor. Calcarea fluor 6x in biochemic form has to be given for 2 to 3 months along with the main remedy, and it can help cure piles permanently. Okay. Now, if you are suffering from bleeding piles, then two main remedies which I have been using is Hemamelis and the other is Collinsonia. These two remedies work wonderfully if you are suffering from bleeding piles. Fine, piles could be painful or painless, but there is lot of bleeding. Fresh blood is coming out of the rectum. Then Collinsonia and Hemamelis. These two remedies work wonderfully. Fine. So these are some of the remedies which I have been using in treatment of piles. Sometimes piles occur along with fissure. Fissure is a cut in the rectum. It can also occur due to chronic constipation. So if piles are there along with fissure, in that case there are two very nice remedies which I am using. One is nitric acid and the other remedy is Ratania. Nitric acid and Ratania, these two remedies work wonderfully if you are suffering from anal fissure and piles. Fine. So these are some of the remedies which I am usually using and giving amazing results, and piles can be treated permanently with proper homeopathic treatment. But it's always advisable to consult a homeopath and then begin with the treatment. Okay. So stay safe, stay healthy, choose homeopathy. And if you have any queries, you can always message me, and do like, share and subscribe my channel. Thank you.